Thank you for joining us on Journey to 600. Today we're going to be focusing on other systems again, but more specifically pressure injury staging.
Alteration.
So here I've laid out a chart of the different stages and what you might see. So with stage 1, there is going to be observable pressure related to alteration of intact skin, non-blanchable box of stage 1. In the last box at the bottom of stage 1, I've included information about deep tissue injury, and how I organize this is stage 1 is when the skin is still intact. With a deep tissue injury, the skin is still intact, but it's a really deep injury, so you're going to see a deep purple surrounded by non-blanchable redness. So that's why I put it at the bottom. It's not technically stage 1, but I don't want you to get something in stage 1 confused with a deep pressure injury. It'll be easier to explain with the visuals that I have on the next slide. Moving on to stage 2, this is when you will see a partial thickness loss of the epidermis, dermis, or even both. The wound bed is pink or red, moist, and may blister. Granulation tissue, slough, and eschar are not present. Stage 3 is when you see a full thickness loss involving damage or necrosis to the subcutaneous tissue. Adipose tissue is visible, but granulation tissue and epiphyly, which is the rolled edges, are often present but may not be. Slough and or eschar may be visible. Stage 4 is when you see a full thickness loss with damage to the muscle, tendon, and bone, and slough and or eschar may be visible once again. Here I've included a beautiful visual of the stages that I just talked about and a deep pressure injury. So looking at stage 1, you'll see that the skin is intact and really only the epidermis is affected. But if you look to the deep pressure injury to your right, you see that the skin is intact, but it is bruised all the way down to the muscle. So you're going to get that deep purple. Then we have a stage 2, which is partial thickness loss, and it stretches down to the epidermis and the dermis. Stage 3 is when it is a full thickness loss, so damage to the epidermis and all the way through the dermis, and you're able to see that adipose tissue. And then we have stage 4, which goes all the way down to the muscle and bone. I hope these visuals helped. I find them very helpful, and it helps me organize it in my brain better. Next, and honestly, most importantly, guidelines to prevent these pressure injuries. So, patients are in bed in the hospital or they're sitting up, and some of them don't want to move too much because they're hurting or one reason or another. But it is important that when a patient is supine, you do not elevate the head of the bed greater than 30 degrees. And if a patient is in side lighting, you want to put them at a 30 to 45 degree oblique angle. And then when they're in the bed, you want to change that position every 2 hours. But if they're sitting, you want to help them get up, get off their butt, reposition in some way every hour while they're seated. But if the patient can move themselves safely, every 15 minutes, they need to be releasing pressure off of their back, bottom, legs, all that. And finally, don't use a donut cushion. Don't pick that as an answer. That seems to be a popular answer choice across all practice tests that I have taken. Don't use it because that little Like the donut, yeah, it sounds nice, like, oh, a little donut, it takes pressure off, but in reality, that little donut hole makes the bottom of patient's butt sink into it, and then they get wounds around the donut bit, and then it pulls down because gravity's pulling down. Don't pick it. You want to, it's tempting, don't do it. I know you want a donut, but we don't want a donut cushion. And trust me, I wish there was a cushion that prevented all pressure injuries, but it does not exist. The biggest thing we could do is get a patient off their butt, back, or legs. Okay, I've spared everyone with pictures of actual wounds, and I did a matching. So stage 1, non-blanchable intact skin. Stage 2, partial thickness of the epidermis and dermis, or both. Stage 3 is a full thickness loss, and stage 4 is a full thickness loss with damage to the muscle, tendon, and bone. Please review that chart. I do find it really helpful for me. Make your own chart, screenshot it, add it to your notes. Okay, the correct answer is D. To prevent pressure injuries, you do all of the following except, so A, 30 to 45-degree oblique angle when patient is inside lying. This is correct. This is what you need to do when a patient is specifically inside lying, so they are not putting pressure on their back or bottom. When a patient is in bed, they need to be changed every 2 hours. That is correct as well, whether that be they're inside lying or laying supine, they need to be changed every 2 hours. Elevate head of bed to no greater than 30 degrees when patient is supine. That is correct. We do not want to raise the head of the bed too high because that puts them on their sit bones. And then we have D. Change position at least every 30 minutes while seated, every 15 if the patient can move themselves. This is a half truth. You need to change a patient's position every hour while seated, not every 30 minutes. Every 30 minutes is, I wish, but that's not what happens in the real world. But the truth of this question is if a patient can move themselves, they need to do it every 15 minutes. But in reality, healthcare workers every hour while the patient is seated. So that is why D is what you don't do. Thanks again for joining us on Journey to 600. Please like, subscribe, and turn on our notifications. And if you guys do want questions with real pictures of real wounds, just drop a comment in below and I would be happy to do a video like that. I just didn't know if anybody really wants to see that on our channel. But let me know. Thanks, guys. Bye.